everyone.
Hi, hello. This is Kristen Schwartz from Gold Learning, and I am here with Dr. Dyah Febriyanti. It's so good to see you, Dyah.
Hi, it's good to see you too.
And you have been working on a brand new presentation here for us at Gold. But before we jump into this, Dyah, tell us a little bit about yourself. You are located where in the world?
Yeah, let me introduce myself again. I'm Dyah Febriyanti. I am the IBCLC. I am a doctor, a lactation consultant, IBCLC, and a fellow of Academy of Breastfeeding Medicine. I work in Indonesia, in Jakarta particularly. I work in three hospitals, and nowadays I found that many mothers is experiencing postpartum depression, but they cover the symptoms. That's
Mm,
why I want to talk about it
mm,
because the postpartum period is there is neuroendocrine and behavioral transition that makes them vulnerable, and any disruption and difficulties will make them in the chaos and will lead to PPD or postpartum depression. That's why the maternal sensitivity will be disturbed if the postpartum depression is not managed as well. That's why
mhm.
breastfeeding it will be disturbed also if we not manage the postpartum depression.
That's correct.
So that's important for us all to recognize the postpartum depression symptoms, although the mother keeps it in cover. Be aware.
Absolutely.
Yeah.
Yes. Yes. And your presentation for the Gold Lactation Online Conference 2024 is titled When Sadness is Not a Symptom, Clinical Approaches for Breastfeeding Mothers with Postpartum Depression. Such an important topic. And you and I, Dia, we were able to talk a little bit before this recording, and you mentioned something that was very interesting to me. You said in Indonesia, postpartum depression is on the rise, and specifically as well after and during the pandemic, and even now, it is still rising. So talk to us a little bit about those statistics.
Okay, because the depression in the after COVID is increasing globally, so that's why in the maternal condition is also rise, and that's why we have to aware because the stigma in the uh, our country, the depression is considered a
Mm,
negative condition, a weakness, or it's not a condition that it's okay to open to another person. That's why we have to dig it deeper and deeper because the statistic is biased because
mhm.
of that stigma. But clinically, there's a rise in symptoms. That's
Yeah. Well, thank you
yeah.
for explaining that. Yes. And that's why it is so important to talk about this topic. As you said, if it carries still in even in many countries, it still carries stigma. So the more we
Mm-mm.
educate in this and talk about this,
Yeah.
we healthcare providers talk about high blood pressure in pregnancy, or other
Yeah.
pregnancy related illnesses. So this should be also just like a
Yeah.
physical illness, needs to be discussed just on the same level, without stigma, just like any other illness or disease. So the healthcare providers and lactation care providers can assist their families, right?
Yeah, exactly.
Yeah.
Because the physical and physiological is a same matter,
Hmm.
same necessity to treat. Like a physical disorder, the physiological or physiatric disease or disorder is also important.
Hmm. Now, when you encounter postpartum depression, do you usually work with the mother only, or you include the entire family? How is this managed? Or maybe it is case by case. So talk to us a little how you work with that.
I work in the hospital-based doctor. I have team consisting lady doctor, pediatrician, and physiatrist. And then what in tackling my patient, I always include the partner and the extended family too, if possible, because in Indonesia there is a condition that a mother living with other family in the same house. So if they can come, I will counsel them in one time. So the mother will have the support for the whole family. But if they are refusing or they refuse to talk in the same time, I will focus the mother and the partner and the other second I mean in the second uh
In another
second
session,
yeah
and maybe, yeah.
yeah, okay.
Very good.
Okay, I'm bloody. Okay, is it
So,
okay?
oh, absolutely. So
Eh,
when you
eh,
talk about your presentation, again, when
yeah.
sadness is not a symptoms, clinical approaches for breastfeeding mothers with postpartum depression, what are you hoping our viewers will learn and take away with them?
Okay. I hope with my presentation, you all will take a message for me that the stigma have to be raised as our issue, our important notes that the mother have to open up to us to show the symptom and sign, because there is uh, some condition that they are closely I mean make the symptoms hid. They
Yes.
hide the symptom in purpose, so they are not labeling negative. That's why
Mm,
we have to recognize and dig it deeper and deeper.
mm,
So the one thing we have to end the stigma,
I have to.
start from ourselves, like this.
Thank you so very much, Dr. Dyah Febriyanti, for coming here today and talking about this very important topic when sadness is not a symptom, clinical approaches for breastfeeding mothers with postpartum depression. Thank you so very much for being here today.
Thank you. Welcome.
And now some information for our viewers. If you're interested in this presentation and all the other great presentations of the Gold Lactation online conference, please visit us on goldlactation.com. We got started with the conference on April 2nd with a free open access keynote presentation. So make sure you sign up for that and share this information with your friends and colleagues in the field. Thank you everyone for watching and have a lovely rest of your day wherever you are in the world. Bye bye everyone.